As an international expert on neuromuscular diseases, Janice Massey has helped to pioneer the diagnosis and treatment of the potentially debilitating muscular disorders myasthenia gravis and cervical dystonia. Myasthenia gravis causes weakness and rapid fatigue in voluntary muscles.
Sometimes patients will have such severe weakness they really cannot even get out of bed.
Massey conducted clinical trials using various immunosuppressant drugs to treat myasthenia gravis, and today those drugs are the mainstay of treatment. Cervical dystonia is a painful condition in which patients cannot control the movement of their heads.
It's very disabling.
In the early 1980s, she pioneered the use of a new toxin, botulinum toxin, or Botox, to treat this debilitating condition.
The idea being to weaken one or more muscles that might be stronger than the rest.
She did not, however, pioneer the use of Botox as a cosmetic treatment, and in fact has some concerns about the claims that its effect is short-lived.
It leaves its mark in the muscle, and the muscle does not completely recover when we look at it physiologically.
Massey arrived at Duke in 1979 for residency and fellowship training and joined the faculty in 1983 as the medical center's first ever female neurologist.
It was certainly interesting, and I think many of the male faculty did not know what to do with me.
But she did have great support from her fellowship director Don Sanders and her husband Wayne Massey, who also was a Duke neurologist. She also cites former Department of Medicine chairs Joe Greenfield and Bart Haynes and Professor of Medicine Nancy Allen as being very supportive of her and women in general. Massey has held various leadership positions at Duke, including Director of the Electromyography Lab, Director of Neuromuscular Service, and Neuromuscular and EMG Fellowship Director. On the national level, as a member of the American Board of Psychiatry and Neurology, she chaired the committee that set the national standards for the neurology profession. As a member of the American Academy of Neurology, she initiated a task force on women that acts as a network for female neurologists, as well as addressing neurological issues for women, especially during pregnancy. As president of the American Association of Neuromuscular and Electrodiagnostic Medicine, she was instrumental in getting neuromuscular medicine recognized as a subspecialty. In 2013, the organization honored her as its Distinguished Physician of the Year. Also in 2013, she was honored by the Myasthenia Gravis Foundation as its Physician of the Year. Massey and her husband Wayne have 2 sons, a daughter, and 1 grandchild. Her hobbies include cooking, gardening, and singing in a church group, but she refused to hum a few bars for the camera.
No, I don't like solo.
She does, however, like what Duke has been able to do for her career.
I don't know that there are many places that have so much depth of resources that allow you to collaborate with others in a totally different area. It's very exciting to be here.